us right now are Ana Marie Pamintuan of the Philippine Star, Lucy Cruz Valdez, the head of News 5, and Robbie Alampay, who should be coming online in just a few minutes of One News. Good evening, ladies, and happy weekend.
Hello.
Happy Monday.
Happy weekend. Happy Tuesday. Okay.
Anyway, but we're starting late, so I suppose we should jump right into the discussion,
Yes.
kasi we're actually 10 minutes late already.
Yeah.
Our first guest for tonight is somebody very well known. It is Dr. Edsel Salvana. He's of course an infectious disease expert and the director of the UP Manila's Institute of Molecular Biology. Dr. Salvana, thank you po for joining us tonight.
Good evening to everyone. Good evening.
Good evening, Doc.
Hi, sir.
Happy to be here.
Po. Sir, of course, you want to talk about a lot of things, among them yung antigen testing. Pero let's start off with something more urgent kasi beginning today, in-implement na doon sa public transportation system yung reduction ng social distancing from 1 meter dati. Now it's 0.75 meters, which is para simple in terms of feet, 2.5 talampakan, 2.5 feet or 2.4 feet kumbaga. So tapos after 2 weeks, kalahating metro na lang, so that's around 1.5 feet, and then 2 weeks after that, 1 foot na lang or 0.3 of a meter. Ano pong inyong opinion doon? Do you agree on the need to cut down the physical distancing requirements?
Yeah, I mean, I understand naman kung ano yung what they want to do. They actually want to fit more people into the vehicle para kasi there is a shortage in terms of transport right now. But the problem is that we don't have any good evidence that reducing it below 1 meter will not be dangerous. Okay, I mean it's an absence of evidence. It's not an issue of whether it's right or wrong. It's that we don't know. Kasi there are 3 main interventions that can decrease the risk of COVID that we ask people to do. One is wear a mask, which decreases your risk by 85%. Eye protection, usually face shield, which decreases it by about 78%. And then the physical distancing of at least 1 meter decreases it by about 80%. If you put all 3 together, mga 90-95% in decrease. Pag tanggalin mo yung physical distancing, nandiyan pa naman yung mask. So it probably won't go below 85%. However, iba naman yung theoretical dun sa actual. Pag nakita mo nagsisiksikan yung mga tao, baka magka-problema tayo doon. So, I mean, I'm not opposed to these kinds of innovations, except that we need evidence. So, you don't want to jump in and implement it agad. Maybe you can start with a small study, and then people who are participating in the study are also informed of the risks, and they can be properly monitored. Kasi yung biglaan na ganito, pag may aberya, kung may problema, marami talagang madadamay. So what we're saying is we're not opposed to innovation, but we want to make sure that these innovations are properly studied before they're implemented.
Dok, para po malinaw, so ibig niyo sabihin wag muna, pag-aralan muna na maigi bago i-implement?
Yeah, I think so. I mean, pag-research naman, usually maliit lang na muna na portion. I mean, it's like, say, sa vaccines, di ba? Sa vaccines, we start with phase 1, siguro mga 30 patients, and then phase 2, mga 200 patients, and then phase 3, doon na nagwa 1,000. Kasi kung may problema early on, you're not exposing a whole bunch of people. So parang ganito rin yung pag nagtatanggal ka ng isang intervention, granted, you're still using masks, you're still using face shields, but maraming hindi tayo alam sa virus na to. Ilang beses na nga tayo nagulat, di ba? Yung asymptomatic, tapos yung problems with antibody testing. So I think that it's prudent to be careful, lalo na with all the things that have happened with this virus. And alam naman natin, pag nagkamali tayo dito, hindi lang additive, exponential ang rise when we have an uncontrolled cluster. So I think that we really have to be very careful para hindi po mawala yung mga gains na nagawa natin over the last few months.
Doktor, sabi nga ng DOTR, meron nga daw, tutuloy naman daw yung face shield, yung face mask, saka bawal pa rin yata magsalita. Pero nakita namin kanina, pati yung pagtayo sa aisle, pwede na eh. Di ba there are also studies na exposure, kahit hindi kayo magkaano ng droplet, exposure sa isang infected up to 15 minutes, pwede kang mahawa. Hindi ba may risk din yon? Kasi mas dikit-dikit nakatayo na yung iba dun sa aisle, nakita namin eh.
Yeah, well, that's the thing talaga. Kasi ang definition natin ng close contact is within 1 meter for 15 minutes. So actually, close contacts na yon. Kung may isa doon na positive, kung sino man malapit ng less than 1 meter sa kanya, you have to quarantine all those people. Granted, the face shield and the mask will decrease the overall risk, but that doesn't completely eliminate it. Kasi for instance kami, mga doctors, yung ginagamit namin ng mga level 3, level 4 PPE, yung para naka-bunny suit kami,
Yes.
yun, almost 100% yun. Kaya namin nahahawakan yung mga pasyente. Pero itong mask at shield, alam mo yung iba, naka-cloth mask lang. Yung iba, yung shield, medyo UP-UP pa. Yung iba, inaakyat nila, binababa nila. It's not a controlled situation. So, I think that we have to be careful. Kasi if we can ensure 100% ng tao naka-mask, 100% tao naka-face shield, tapos mamomonitor natin sila na maayos. Pero kasi iba naman yung reality eh. The reality is hindi perfect itong mga interventions na to, and the more that we use to decrease the risk, the better. And we can't afford to remove something that is beneficial if we're not sure kung ano yung magiging epekto nito.
Doctor, ako yung tanong ko is not really on the level of the medical science. It's not on the level of research and data. Ang tanong ko is really on the side of just the communications. I mean, as doctors, as scientists, as researchers, you know, it's hard enough. It was hard enough communicating to people how to properly behave. Even social distancing needed some time before kumagat sa mga tao. Ang tanong ko is, on the communication side, on the behavioral communication side, I mean, how concerning and how frustrating is it to be getting these infographics, for example, as if you're encouraging people to not tumayo at umupo even closer?
Yeah, that's exactly a huge problem. Kasi kung parang we're sending the wrong message na parang we're already on top of this problem, eh ngayon pa lang nakikita natin na okay, medyo nakakahinga yung mga hospitals, but that's because we did all these things that we did in the last few months and the last few weeks. So this is not the time to ease up. You know, we want to make sure na at least 14 days, 1 month or 2 months na sustained itong gains natin. I mean, we're seeing the number of deaths start to increase, and admittedly, you know, that may delay naman talaga doon. Kasi mas mabagal mamatay sa COVID rather than yung nagkakaroon ka and becoming symptomatic. But, you know, the indications are that this is really for the long haul, at least until we get a vaccine. And even if we get a vaccine, matagal pa yan. Kasi syempre, i-distribute mo. So I think that we have to give the message na, alam mo yun, stay the course tayo. Alam natin mahirap, pero, you know, understanding that we have to balance the economy, but, you know, not at increasing the risk that ma-shutdown tayo ulit, di mas lalo babagsak yung economy kung ganun.
Actually, you have, on another topic, no, you have suggested an entire household quarantine. I'm so interested in that. You're in effect saying that if one member of a household gets positive, that you should essentially shut down the whole household, in a sense, no? In the same way that we're doing that now in private companies, right? Is that your suggestion?
Well, it's not a suggestion. It actually should be standard. Why? Because household contacts are all considered close contacts. So, if somebody turns positive, yung buong household, close contacts yun, they have to quarantine for 14 days. Now, the question is whether you take out the person who is positive or not. And the problem nga is, you know, it would be great if we could 100% rely on people if we tell them to self-isolate in their room, that they really will stay in there. Alam naman natin na there are, you know, some imperfectness in these kinds of plans. Now, if it's a big household and there's banyo and, you know, you can still monitor, then it's okay. Pero kasi yung mga pinopropose nga nila General Año, nila General Galvez, is because there are problems with ensuring that people stay in their house if it's entire household quarantine, or the person who is isolating, who is positive, actually stays in their room. Now, it's a difficult situation, but the recommendation talaga is that we need to quarantine entire households Because if we only isolate the person who is positive, presumably all those people in the household are close contacts. As several of them will become positive and they'll be walking around, and there will be more spread in the community.
So the idea is isolate the one that was positive, as in removing him from the household, and for the rest of them, they'll be inside the household for 14 days. But what if they each have a room with bathrooms? Are they supposed to isolate themselves, each one of them, in their own rooms, and let the positive one stay within the household as well?
Well, again, that's more of an operations issue because again, presumably they'll be tested. Some of them may be symptomatic. Some of them are not symptomatic. Again, anybody who is positive can stay in the household if they can be properly isolated. But if they cannot, then it's better to bring them somewhere. Or siguro if they're symptomatic and they're short of breath, they need to be in the hospital. These are not easy things to do, especially, nobody wants to be taken out of their home.
Yes.
And at the same time, it's very inconvenient to take out half of a family, say half ng family nag-positive at half ng family hindi. The easiest really would be to household quarantine at the very least. And we know this will have an effect. Now, whether you take out the positive person is dependent on how well we can isolate them within the household and also yung physical setup. Kasi kung wala siyang sariling banyo, lalabas at lalabas yan. And finally, our ability to keep tabs on them and make sure that they're complying.
You were saying that this is actually far more effective than doing mass testing, no? Can you explain the figures there?
Right. So that's from a paper by Adam Kucharski, who's actually from the London School of Tropical Medicine. He's an epidemiologist. He's also a good friend of mine because we're both TED fellows, and we do have these kinds of discussions. But his paper in the Lancet Infectious Disease basically looked at the efficiency of different interventions. And so when they did the mathematical models, if all you're going to do is mass screening of 5% of the population every week, the impact on transmission is 2%. Can you imagine in the Philippines, you spend 10 billion pesos every week for 5 million tests, if ever we can get to 5 million tests, and yung effect mo is what? 2%. Whereas, if you do entire household quarantine, the effect is 35% decrease. If you couple that with proper contact tracing, then and also you can do digital apps, you can do ito nga yung with targeted testing. The effect is 65%. And I don't think that will cost 10 billion pesos a week. It's probably going to be cheaper and the effect is much, much more. And so the testing, hindi naman niya sinasabing wag mag-test. Of course, we have to test because we have to keep track of people. We have to make sure na people are, that we can find yung contacts, yung close contacts. But to randomly test 5% of the population every week, actually kahit dati pa sinasabi na namin, that's not doable and it's not efficient because number one, our tests are not perfect. Our tests at best can detect maybe 80% of positive people. On most days, not nga baka 60% lang or 50%. So you really have to time and also risk-based. For instance, if somebody's asymptomatic but was a close contact, you should wait at least 5 days from the time they had contact before you test them. Because if you test them earlier, malamang false negative yan. So, there are a lot of these caveats in testing. The testing is not perfect. So it's really not a solution outside all the other things that we have to do.
Mm-hmm. How are we going to move this forward, Doc, with the OTR suggesting this less physical distance? At the same time, the IATF meeting tonight to finalize whether or not that should push through. But it's all, again, for the sake of the economy. Where are we in terms of moving it forward, considering that today we racked up a record number of deaths, no? And the number of positives is rising again to 4,000. Where are we exactly?
Yeah, so it's always tricky to go on a day-to-day basis because we know that some of the positives are, from way back. Itong deaths nga, more than 100 of them happened in July. So, minsan nag-iipon lang talaga and natatambak na ganon. So, actually, you have to take a look at the graph kasi redistribute nila yan according to date of death. So, it's not exactly 236 died within the last 2 weeks. It's actually in the last 3 months. So, we have to look at those as well because it's spread out there. But definitely the number of deaths has been slowly rising since before. But, overall, again, the issue is if we look at our overall deaths in the Philippines, compared to other countries, actually it's pretty remarkable that we're in the top 25 countries with more than 100,000 cases. We have the third lowest number of deaths. The only better countries than us are Saudi Arabia and I think Israel. But you look at Germany has 9,000 deaths and much more cases than us. Italy has 38,000 deaths. Can you imagine? We have 4,000. That's remarkable considering our number of cases. And this is because we shut down early. We've been doing some modeling, and if we had shut down 2 weeks later, 10, 20, 30,000 deaths, sigurado. Because again, exponential ang increase sa infectious diseases. And so the decision to shut down saves lives on a daily basis exponentially. Kasi the other nice thing about shutting down early is that it gives your healthcare system time to adjust, and we also learn how to treat the virus much more efficiently, and we can ramp up. So if there is one really good thing that this government did, it was shut down early because even a 2-week delay would have meant 10, 20,000 more deaths.
Pero in the
Doctor,
meantime, Doctor, seeing the latest developments now, kailan lang nag-request ang mga medical community ng time out 2 weeks? Sa ngayon, yung mga nangyayari ngayon, what else do you want to see in terms of the government response? May mga kulang pa ba? What do you want to see ramped up? What do you want to see na matigil? Meron bang mga ganun kayong suggestions?
Yeah, I mean, I advise the DOH, I advise the IATF, and I think we already have the tools to defeat this epidemic. The problem is really adherence, ensuring that people, wear the masks properly, consistently. Nakakasawa rin kasi, admittedly naman, lahat naman tayo ang hirap magmamask ka buong araw. Yung iba nga sa bahay, lalo na if somebody is exposed, and you know that you might not be able to physical distance properly. We know what works, but it's difficult. But yun nga yung kailangan talaga natin, bantayan natin. And also, I think it's really important that we're united in this. Kasi there's a lot of noise, there's a lot of fake news, there's a lot of acrimony. Ito nga, di ba, syempre ngayon tinitira natin ang DOTR. Understandably, there's a lot of disagreement in that. But what we really need is good dialogue. Kasi if you start yelling at people, they're not going to listen to you, di ba? So we have to talk and say, wait a minute, we don't think that's a good idea. Maybe we should sit down and talk about it. This is what we think. Rather than yung nga, nagbabanatan na sa social media, I mean, lahat tayo, lahat tayo pwede magkaroon ng COVID. So we really have to work together to get this under control. And we can't, just say na, okay, mali yan, hindi yan. I think that we really need this dialogue. Alam ko, lahat galit na kasi syempre everybody's really been mentally affected by this pandemic, quarantine, and everything. But, it's not going to get better if we don't get our act together.
Doc, nabanggit niyo na lang din yung ibang bansa. What's happening in these other countries or other cities that are having to take a step back and are reporting more troubling numbers again? What's happening here from Asia to Europe to other countries? What do we know about not just they're having to reimpose stricter regulations, but what is causing this stepping back?
Yeah, well, I mean, when you open up talaga, dadami talaga yung opportunities for the virus to spread. And that's why it's so important that everyone adheres to minimum health standards. And then, of course, this report of D614G, which is supposedly at least 3 times more infectious. And then, now in other countries, it's starting to become cold. People spend more time indoors. So, nagpapatong-patong yan And again, this is a virus. This is an infectious disease. Wala naman tong utak eh. Pero what infectious diseases do really well is spread and infect other people. So what's very important is, yun nga, alam natin yung tools. We have to use the tools. We have to be consistent. We have to stay the course no matter what.
Doc, in the
Doc,
past-
quick lang, only because nabanggit nyo that it's cold. I'm just curious, bare months na, we're heading to that. On top of that, nag-uulan. Is there something to be concerned about there?
Yeah, I mean, magde-dengue na rin to. Tapos magkakaroon pa ng leptospirosis. Any fever right now, iniisip namin COVID eh. And that's why we also said people should get their flu shots para hindi mo mapagkamalan yung flu na COVID. You know, this is not going to get easier in terms of, you know, all the other infectious diseases that are coming in. But again, we know what works. I mean, paulit-ulit lang parang silang plaka, but we have to keep doing it because these are our best defenses until we get a vaccine, until we get more medications that work really well.
Okay.
Doc, in the past few weeks, you've been hearing more and more about yung antigen testing. What should we know about antigen testing? When will it work, and when will it not work?
Yeah, so antigen testing, the advantage of antigen testing is it only takes 30 minutes to an hour to work to come back. It's like a PCR, except that it's maybe only 80% the sensitivity of PCR. So dun yung problema niya. But again, malaki yung difference kasi yung PCR takes 2 to 3 days to come back. So ako from a doctor, I love it. A doctor, I love it because I know exactly what to do with my patient agad. And yun nga, the only problem is, kung positive siya, sigurado akong positive na siya. Kung negative siya, I have to think about, well, is it just missing the disease? Do I need to do other tests? But just to get somebody back na positive almost, you know, in 1 hour is a big thing. And then, you know, we can talk about serial testing, repeating the test after 3 days to cure these kinds of problems, or use it in conjunction with PCR. There's a lot of possibilities. WHO actually released some guidance last Friday, and we're still trying to go through it. Kasi even before WHO release, pinag-uusapan na namin sa IATF and even sa DOH on how to use this for the last 6 weeks actually. But just when we got to a point where may agreements na, naglabas yung WHO ng bagong guidance. So now we have to take a look at what WHO said and try to harmonize that. So hopefully we get that out pretty soon.
But it's not going to replace PCR testing.
It won't, but you can use it as an initial test. Kasi kung positive na siya, hindi mo na kailangan mag-PCR. Kung negative siya, doon ka lang mag-iisip, kailangan ko pa ba ito yung PCR o hindi?
Meron pa bang value yung antibody, or talagang that's really outside the door na?
Yeah, the antibody test, yung rapid antibody test, probably not. Pero yung mga ELISA at saka yung CLIA, we can use them to diagnose people who already have recovered. And you know, you can use it to determine in a community how many people have had COVID. Yun, pwede yun, blood test. Pero to diagnose somebody who has active COVID, it's not very good at that because it only becomes good after about 14 days from the time that symptoms start.
Yeah. Okay.
Dr. Edsel Salvana. Doctor, maraming salamat po for joining us tonight. Si Dr. Salvana, of course, is Director of UP Manila Institute of Molecular Biology.
Thank you.
Thank you po.
Salamat po. Maraming salamat, Doc.
We will just pause for a break, so please stay with us.
Nick, Prof. Ranjit, and Dr. David. Pa-testing lang po ng mic niyo kung pwede. Saglit lang po.
Okay,
Baka
can you hear me?
Yes po, Father Nick, naririnig po kita. Prof. Ranjit, pa-test po ulit.
Yeah. Can you hear me?
Okay po. Apo, naririnig po kita. Dr. David, naghang po yata si Dr. David. Hello po. Ayun po, okay na. Sige po, start na po tayo.
Welcome back, the Chiefs. We're now in the final stage of our conversation. Joining us are Professor Ranjit Rai, Dr. Guido David, and Father Nicanor Austriaco of Octa Research. Gentlemen, welcome back to the Chiefs.
Good evening. Thank you for having us on the show.
Good evening.
Yes, sir.
Hi, sir.
Good evening.
Hi,
Good
Father.
evening, everyone.
Okay,
Welcome back.
wala pa si Dr. David. Let me start with you, Professor Rai. We just want to test a hypothesis kasi dati, nung mag-isa si Dr. David dito, everything was good. Ang saya-saya namin. Everything was so positive. Everything was so encouraging. Sabi ko, pagka nandito si Professor Rai, sigurado, mega yan, mega. Let me just start with you, Professor Rai. Sample lang ko lang yung
Ito
turing
na.
ko. How are numbers now? What are you seeing?
My theories, the more the merrier.
The prophet of doom.
Professor Rai, in all seriousness, your latest numbers, your latest figures. Let's start with the big picture. What are you seeing?
Okay, I'd like to, for the numbers, I'd like to, with all due respect, give it to Professor David, because he's the numbers guy, and it's better to listen to a mathematician than a political scientist as far as numbers are concerned.
Okay, agreed. Okay, Professor David. Okay, we'll start off again with you. We were telling wala ka pa kanina, but sabi namin the last time you were here, wala sila Professor Rai. Everything seemed much better. Mas masaya kami after speaking to you. Ngayon nandyan sila. I mean, what are you seeing sa numbers nyo? Ano ba tayo ngayon? Positive,
Yes.
optimistic, hopeful?
Kasalanan niyo, in-invite niyo si Professor Rai. So, nawala na yung pagka-positive natin. So, nakakawa yung ano. But we'll be, we're always reporting transparency. So, right now, NCR is still holding up. The reproduction number is still less than 1. There's a slight uptick in numbers. But we're seeing a lot of emerging new hotspots ngayon, especially sa Calabarzon and sa Central Luzon. So, Calabarzon, we're seeing it in Cavite, Rizal, Batangas, particularly. And then sa Central Luzon, we're seeing it in Bulacan, and of course, to lesser magnitude, Bataan, Zambales, even Tarlac, Nueva Ecija. And then up north, we're also seeing it in many provinces up north: Pangasinan, La Union, Isabela, Cagayan. So actually, there's a lot. Although, yes.
Go ahead.
Go ahead.
Go ahead. We can hear you. Nag-ano siya?
May noise kasi. Father, let me
Nagsalita.
turn. Hello, Father.
Yes.
Let me turn to you. Let me turn to you. Ano kung what is your reading of the numbers that's being shared by Professor Dr. David? And a basic question: these numbers now factor in the GCQ that was our return to GCQ.
So, yes. So, as my colleague Professor Guido pointed out, the most significant findings, of course, is that the R numbers are still below 1. And this is, we're maintaining the inertia, the momentum coming out of the MECQ. And you can see that despite the large caseload today of 4,000 plus, as I think your previous guest pointed out, this is over many weeks, many months. And if you look at the curves are still dropping for the country and for the NCR. However, as Professor Guido pointed out, adjacent regions to the NCR are witnessing surges. And one of the things that you realize is that each of these regions will affect the NCR because people are moving back and forth. So we have to be very careful. The LGUs of these respective regions have to double their efforts to make sure those numbers go down. Otherwise, what you will see is an overflow of the pandemic from these regions, Calabarzon, Central Luzon. Over time, they will leak into NCR, and then we will have another issue with surging. So we are basically saying that things are good, but we have to be particularly careful with these hotspots to make sure that they do not leak back into Metro Manila.
Father,
But
you're
that-
talking about moving back and forth, no? Ang latest development, of course, ngayon, which is a controversy, and I think will be discussed by the IATF tomorrow, is the reduction of the physical distancing on mass transport. How is this going to affect your projections of
Well,
the
so-
flattening, and what will it do to our efforts to sustain the flattening of the curve?
So 2 weeks ago, there was a paper published in JAMA Internal Medicine of two buses in China. The two buses were transporting people to a local church. In one bus, one person had COVID, and the other one, no one had COVID. And it turned out that after the event, 35% of the passengers of the one bus that had the COVID-19 turned out to have COVID. And so what you have here is a super spreader. And the concern that we would have if we try to minimize the social distancing is that you would have super spreading events on mass transportation. And anyone who is trying to manage a pandemic is especially concerned with super spreading events. So a super spreader is one person affecting more than 2, 3, 4. In this case, I think, let me just look how many people there were 24 of the 68 passengers on the bus got COVID from one infected patient. Now, I have to say this report was prior to the using of masks in China. However, and this is of the concern, our buses and mass transportation are air conditioned.
Yes.
And so you have an enclosed space, and the air is basically breathing and rebreathing. So even if you're wearing mask and face shield, if you're in there for an hour, that air is going to be, it's not being circulated. Now, contrast this with an airplane where the air in the airplane is recirculated every 2 minutes. So every 2 minutes, the air is completely recirculated and passed through a HEPA filter that filters out many of the droplets and things like that that will transmit the virus. So this is our concern. We want to minimize spread. We want to minimize super spreading. And as this report pointed out 2 weeks ago, one person on a bus, 34 people, 24 people out of 68, 35%. You have
Father, yeah. Father, as you know, as Father, go ahead.
Can I just point out that people will say, okay, you're in a bus, it's air conditioned, all right? You're all wearing masks and a face shield. What would a 0.25 meter difference actually make? I mean, what's that? You're just basically coming closer to the next person to you by 2.5 rulers. So what's the big deal? That's what they're going to ask.
So the big deal is the total number of people on the bus. So if you have social distancing of 1 meter, the maximum number of people on the bus is less than if you're sitting next to each other. So it's not necessarily just how far you are from the person, but how many people on the bus, each of whom is a potentially infected COVID-19 patient. So if you have twice the number of people, you double the probability that there's a COVID-19 patient person on the bus. So it's not just about it's not just about social distancing, it's de-densifying public transportation. We are trying to decrease the number of people in a enclosed space, right? Now, it might be different if the bus is completely open, there's no aircon, there's circulation of air, but this is the Philippines, it's hot, so there's going to be aircon.
Okay.
Professor Rai, inabanggit ni Father, de-densifying the people inside mass transportation. But of course, as you know, we're not blind to the objectives and the rationale here. The government is trying to reopen the economy. They want to move more people to more places and allow them to get back to work. What options does government have right now? Now that you factor in, as we've been talking about this for the past month or so already, a reopening of the economy. If we see these numbers of more people working having an impact on the public health side, especially with these new protocols for mass transport? And what do you see happening to government's confidence to reopen the economy?
Okay, so number one, we just want to make it clear, Octa Research is against this move of the DOTR to reduce the distance, no, in public transportation vehicles, no, whether it's bus or jeeps, no. We understand the agenda is to get more people out to work, no, and we understand that this has also impact on the business side of buses and lalo na our jeepneys, no, who are languishing.
Yes.
Naputol ulit.
Mm.
Mm.
Well, nagpo-protesta nga. Well, what about Professor David? Professor David, balik na ba kayo? Is it
Yes,
going
hi.
is it going to affect your projections for maybe the next month? Etong reduction ng physical distancing on mass transport, is it going to affect your projections?
Right now, it's premature to say. I mean, of course, it hasn't been implemented yet. By how much it will affect the projections, it will depend. So we will have to see. Because there are a lot of factors in play here, and how they affect the projections. It's not an exact science yet, or it's not an exact science. So we'll have to see if it plays out. So I mean, you can think of it as as data gathering. So we'll be gathering data once if it is implemented.
Yeah.
Prof, I'd like to go back to what you mentioned kanina, yung surges dun sa ilang provinces around Calabarzon and Central Luzon. How significant were the surges, and have you been able to pinpoint exactly the reason for the surges? Is it because of the GCQ, or was it something else?
The surges are actually significant. It's to the level of number of new cases per day has doubled over 1 week in many provinces. Sometimes they increase by 50%. In some cases, they nearly doubled, and that is significant. Although these are on a smaller scale, like for example in Pangasinan, we might be talking about 20 cases per day. So maybe this is something that can still be managed. Pero in provinces like Rizal and Cavite, the caseload is already high. They're averaging more than 100 cases per day. So this is now significant, and it can pose a real challenge to the way we're dealing with this pandemic. And we haven't yet pinpointed what the source of this surge is, but I haven't kept track with Calabarzon. I know some provinces are still in GCQ, so I'm not sure.
Reporting, because the Department of Health has said that we should expect an irregularly high number in the coming days. They said this last Friday. So this has nothing to do with the recording. These are new cases, in effect. That's what you're saying.
Well, we're seeing also the trend in positive tests. So the surge is actually, we think it's real. There's also an associated increase in positivity rate, although the positivity rate increase is slight. But we think at least it's an uptick. But the number of new cases, is doubling in some provinces. This is significant. So we don't see it as just being an uptick. In some provinces, it could be an uptick. In NCR, there was a slight increase. So, but overall, as Father says, it's still decreasing. So NCR is still okay right now. But if there is a surge in the nearby provinces, as Professor Ranjit and Professor Father Nick has mentioned, then it could affect the pandemic in NCR.
Professor Ryan,
Professor, but when
nakabalik na si Professor.
Come again, yeah. Yeah, no,
Yan,
You were
kayo.
cut off earlier.
Yes.
I wanted to answer Robbie's question. We need to increase buses and jeeps. There is enough leeway in the Bayanihan Hilas 1 Act for us to expand what we call service contracting, and I think that's the way to go. Government subsidizes part of the cost of expanding transportation. There's the bus rapid transit, which they can fast track. So there's quite a number of other options apart from apart from what they plan. So we need to expand number of jeepneys and buses flying the routes. So that's what I think. Yeah.
okay.
So deploy
Professor,
more mass transport units instead of reducing the physical distancing.
Yes. Yes.
Are you going to report this to Malacanang? Because you're being consulted na by the IATF, di ba?
Yeah, we're submitting tomorrow our latest findings, and so we're hoping that it will have some impact. We're really against this, changes in policy. It will cause confusion. It's hard to
Yes.
administer and sustain, and we feel strongly that if we're not, the masks we're using, for example, are not all the same. Okay,
Yes.
and the only thing stopping us is the physical distancing. Not all masks are created equal, especially in an enclosed area. So cloth masks are not known to be very effective as compared to N95 or the surgical masks. So again, there has to be more study put into this policy change or program change, no? And that's because we don't have that study. I don't think we should change our rules on our protocols on physical distancing. And maybe we hope that DOTR will reconsider this.
okay. Ay, Professor David, yung question lang ako dun sa yung sa R naught at sa positivity rate we're saying is still relatively stable. R naught is still below 1, as you said. But when we say that, are we talking about NCR or are we talking about the national numbers?
For NCR, it's still below 1. Nationally, it's almost at 1. So it's being balanced by the lower number in NCR, and also other major areas like Cebu is below 1, of course. Some of the previous hotspots we mentioned have decreased in numbers. So Bacolod is now on a decrease, on a decline. Ilo and Capiz are also on a decline. Pero it's now being counteracted by the increase in Calabarzon. And Bulacan, Bataan, and Zambales, their R is now greater than 1. It's around 1.2 in those provinces. So those are definitely, causing the overall average to go up.
Yeah, okay, because that was actually why I was asking Father also, because if you're saying the numbers are troubling outside of the urban centers, but we're seeing nationally the numbers are stable, then inversely what we're saying is on the other side of what we're seeing in the countrysides, in the provinces around these urban centers, that the urban centers are actually not only stable, they're still showing really good numbers, really encouraging numbers. Is that right?
Yes, that is correct, Robbie. So yung NCR and Cebu have stable numbers, a slight uptick, but it's still below 1. But now we're seeing the increase in Calabarzon and Central Luzon, and some of the northern provinces, I think in Region 1 and Region 2.
The mayors have recently, actually today, come together to vote that there should not be major gatherings on dusk. In fact, I think they're banning going to cemeteries altogether. You agree that that's a wise move, considering, it's an age-old tradition.
I think Father should comment on that because he's the priest. So he's the one who's gonna supervise the prayer.
So The typical answer for mass gatherings is that mass gatherings are possible. People can maintain minimum health standards of social distancing with masking and with shields. The challenge, of course, is that this is going to be incredibly difficult here in the Philippines. So my mother is from Bicol, and this week is their fiesta. And what they had to do for Our Lady of Peña Francia is they had to lock down Naga to prevent people from coming, millions of people from descending on Naga for her feast day. And I think the Mother of God understands because she loves her children. She understands that sometimes you cannot visit your ina if this is going to cause a lot of illness. And I think the same thing happens here for All Saints and All Souls in November, right? So our deceased loved ones, they know more than we now, they hopefully in the sight of God. So they understand that we are fighting a once in a century pandemic. Many of them remember when they went through the pandemics in their day and age. So, when you have a supernatural perspective, I think the Lord understands. But we have to, and I think that we have to move our celebrations and our prayer to the home, right? So, and even here, we have to be very careful because you have to shield Lolo and Lola. And the danger is that you will go to your Lolo and Lola's house and without proper precautions, and you will bring the virus with you. So I think, there is a legitimate place, of course, for prayer, especially now. But this should not, we are still called to be reasonable people, especially as for Catholics who are called to have a balance between faith and reason. The Lord will understand. You can explain, and our loved ones will understand, those who have gone before us. Like I said, I found out from my mother that her lolo died in the cholera pandemic in the Philippines in 1907. So we have loved ones who died from the pandemics in the past, primarily cholera. So I went and did research on this, and the Philippines, especially at the beginning of the 20th century, had multiple instances of pandemics in many provinces where thousands of people died. So now I found out, including my great Lolo. So I think that, like I said, as a priest, we pray, but we are careful as well.
But
Yeah,
Father, perhaps it's not God or the saints who have to have understanding. It's the public. It's the people who have to be able to understand this. Because a lot of it is also cultural and behavioral. People go to the cemeteries because it's been a practice, it's been tradition. In fact, they celebrate nga araw ng patay on November 1, which is not even All Souls Day, di ba? So it's more of a problem of people understanding more than, I suppose, more than the people in the heavens understanding what we're doing.
Well,
And
honestly,
how do we address that?
I think this is where the church has to have her voice, because I think this is where the church should speak, and the bishops of the Philippines should make it very clear that to the people that it is not, you are not in any way being disrespectful to your deceased loved ones, and that for the sake of everyone around us, we have to social distance. And like I said, in Naga, they locked down the city for the entire novena to prevent people from mass gathering. And so the question has to be addressed about whether or not maybe it might be important to close cemeteries during these days to prevent people from gathering in them in a way that makes it difficult to control social distancing.
that's a good idea, no, for the church itself, for the
Oh,
church
yeah,
themselves to actually.
she has, because if the government says it, the people will
Yeah.
not listen. But if the bishops and the priests say, look, this is the time when we have to make sacrifice, and for the sake of the country and for the sake of all of us, and then you have a conversation between the church and the government, and the civil authorities can close the cemeteries, and the church can explain to the people that this would not be a problem. There are good reasons why we have to do this year, and we can hope for a wonderful celebration next year, double double the amount of celebration.
All right.
Okay.
Okay.
Okay. Always a pleasure to have our trio of experts from Octa Research with us. Maraming salamat po, Professor Ranjit Rai, Dr. Guido David, and Father Nicanor Austriaco of Octa Research. Gentlemen,
you.
maraming salamat
Thank
po for
you.
joining us tonight.
Be safe.
Salamat po. Salamat.
Yes.
God bless.
Okay.
Sorry.
Ayan.
Okay.
Dapat pari na.
Positive ko rin naman yung message nila kayo naman. Oo. Generally positive pa rin.
Kaya nga si Professor Rai hindi nakapag-ano eh.
Yan lang sa mga
Tinutol na.
Nakapag-cambio eh.
Tinutulan ng data.
Wala pa, kulang pa nga daw, pero baka suspended. Anyway, we're waiting for an announcement again.
That's
Tonight.
right. So,
Oh yeah, it's a
ano bang
Monday.
before we wrap up, ano bang latest update dyan? We're just basically waiting for the
Yes.
IATF meeting and President Duterte, we're expecting to speak.
Yeah, merong alert ang Malacanang na tonight. Kaya baka may decision din dyan sa mass transport na yan. So baka although bukas pa yung IATF meeting with Octa. Saka yung baka magsalita siya about the PhilHealth report which was submitted today. Tignan natin.
Okay.
Okay. And also maybe also about Pemberton who left over the weekend.
Yeah.
Wala na si Presidente doon. I think sa kanya tapos na. Sabi ni Harry Roque, court martial daw pagdating sa US.
Yeah. Court martial talaga yun.
Court martial.
And tapos kanina sa budget hearing si Secretary Medellea linked was talking about Pemberton's release and sabi niya kasi importante yung VFA implications ng Pemberton issue.
So ni-link na niya directly.
Oo.
Okay. That's good to know.
Parang just 9 months ago we revoked the VFA over visa. Ngayon sobrang tayong ingat. Okay. Sige, that will be all for this Monday edition of the Chiefs. We hope to discuss here. We'll keep the conversation going. I'm Edling Gaupa News.
I'm Mami Pamintuan of the Philippine Star.
I'm Lucy Cruz Valdez of News 5.
I'm Robbie Alampay. We are One News.
Pasahero at kulang ang maisasakay nilang pasahero, mahihirapan po sila at hindi po sila papasada kasi nalugi po sila.